What is direct current electrotherapy, or eXroid? It is essentially a battery. There are two terminals on a battery, a positive and a negative. In this case, the positive terminal is a saline-soaked sponge that goes underneath the patient's left hip, on which they are lying on the couch. The positive terminal is the two tips of the probe that rests on the base of the hemorrhoid that we're targeting. When we turn on the current, it gradually goes up, and we do it very slowly over 1 to 2 minutes to try and get the patient used to that current and to find their level of tolerability. The idea of this treatment is that it is not painful. It is going to be a little uncomfortable, but we don't want it to be too uncomfortable, and we can judge the level of current used so that we get just that sweet point. We want the treatment to progress steadily so that we can shrink the hemorrhoid down that we're targeting. eXroid electrotherapy works by using low-dose direct current to generate a coagulative effect on the mucosa on which the probes are in direct contact, and then with additional time to coagulate the blood vessels deep to the mucosa, which ultimately leads to those blood vessels shrinking and being dissolved as part of the healing process. What is going on when we're observing the treatment is that we can see some white frothing, which is the hydrogen gas produced as part of this process, and we can hear a little bit of crackling, which just tells us that the reaction is ongoing. As you know, eXroid electrotherapy is one of a number of different treatments, and we believe that it is better than the other treatments for a number of reasons. One, it is the only treatment that can be successfully used on all 4 grades of internal hemorrhoid. Surgical techniques will tend to be reserved for the more severe end of the spectrum, the grade 3s and 4s, and other treatments such as banding will be used on larger grade 1s, grade 2s and smaller grade 3s, but are really not applicable to the other treatments. So that is just the 2 most common treatments that are used, and eXroid can be used on all of the treatment, on all of the different grades of hemorrhoids across the full spectrum. The other factor that makes it better is its comfort level. Patients can walk in, have it done, and walk out again with a minimum of fuss and get on with their daily lives afterwards, whatever they want to do. The other thing that's important is around the safety aspects, and that is, it is the safest treatment as judged by other treatments and the studies that have been done, because it has a very low serious adverse event rate. Patients get very little in the way of complications afterwards, bleeding, bit of discomfort. A few patients may get a bit more severe pain afterwards, but it usually settles with simple paracetamol only. And there isn't another treatment where those qualities can be articulated in the same way. So what a patient's experience as the treatment is ongoing? Well, the first thing you'll be aware of is that you'll be laying on your left side with your knees curled up towards your chest, and there will be a small tube called a proctoscope inside the anal canal, and that can be a little bit uncomfortable, the actual act of popping it inside, but we use a lot of lubrication to do that. Once you've got the proctoscope in sight, we will be able to identify the hemorrhoid we're going to treat, and then we will apply the tips of the probe on the base of the hemorrhoid at the point that we want to target, and then slowly increase the current. So as the current increases, some patients will be aware of nothing apart from the fact that the tube is in place. Others will be more sensitive, and they will be aware of a little bit of aching, some stinging. Some people describe it, some people just say it feels weird without being able to articulate exactly what it is they're feeling. And some patients in certain areas may get the sense that they need to have a wee, which is one of the reasons we always ask patients to empty their bladder before treatment starts in case they get that particular symptom. And that's because it's electrical current, it's stimulating a particular nerve that gives the brain the message, I need to pee. You don't, and we talk you through that and reassure you. We haven't had any accidents yet, and we've treated thousands of patients. So that's during the treatment. At the end of the treatment, when the current is reduced and the proctoscope is removed, You are aware that something's happened, but there shouldn't be any significant discomfort at that point. So some patients may get a bit of pain during the treatment, but it usually stops as soon as the treatment stops. When they get up, they get dressed, and then usually within a few minutes they're feeling much better and onwards and upwards with the rest of their day. So the healing can take place slowly over the next week to 4 weeks, and during that time the symptoms that you present with can improve to a greater or lesser extent depending on the severity of the symptoms that you present with in the first place and the size of the hemorrhoids. But more than that, it depends on the breadth of the hemorrhoid from an anatomical point of view. So the narrower it is, the more likely it is to respond more dramatically to the treatment undertaken. For example, we have had patients with grade 3 and grade 4 hemorrhoids that have very narrow bases that have responded to one treatment alone. But we have had patients with smaller hemorrhoids that are broader based that have needed more than one treatment. And indeed, the majority of patients with larger hemorrhoids, where they've been there longer, tend to be broader based and tend to require more than one treatment. However, across the breadth of the patients that we do treat, on average, overall, less than 2 treatments required. So that gives you some indication as to the positive nature of the treatment on addressing the symptoms. Some patients, though, after they get off the couch, they'll feel better straight away. Others, it will take up to 4 weeks before they get the full benefit of the healing and the symptomatic improvement associated with that. Having said that as well, there are some patients who after 4 weeks don't feel a lot better. And that's usually those with those broader based hemorrhoids where a further treatment is going to be required to really make a significant impact. And then a smaller group of patients may need more treatments than that to get that full symptomatic improvement that they're seeking. Some of the symptoms will improve better than others. So for example, bleeding is one of the symptoms that tends to respond quite quickly to treatment. Whereas if you have prolapsing, usually those are grade 3 hemorrhoids, that can be a more difficult symptom to resolve in one go, as I said, particularly with those broader based lesions. If they're narrow based, they can go in one hit. And when we look at patients after 4 to 6 weeks after their first treatment, irrespective of the improvements that they may or may not describe, we can see differences inside. And there have been patients who have presented with 3 grade 3 hemorrhoids at the first visit. They've come back at 4 to 6 weeks for an assessment and further treatment because they've still got symptoms. And inside, 2 of those hemorrhoids have completely gone and 1 is still a grade 3. There are more blood vessels feeding into that area, which we can then target, and then usually we will see significant improvement in that hemorrhoidal cushion, and hence patients will see further improvement in their symptoms. Some patients, when they present to us for the first time, having thought about their symptoms, having asked about their symptoms, maybe having seen the GP but not necessarily, will have spoken to our colleagues on the phone to book an appointment. But it's not clear that whether what they're suffering is actually hemorrhoids. The assumption is that that is the case because of what's described, and an appointment can be booked. When the patient actually turns up on the day, they may have a certain amount of discomfort. They may actually be in pain already before getting anywhere near them. And it depends on the quality and the cause of that pain as to whether an assessment can be carried out, an examination can be carried out, and if appropriate, a treatment carried out. For example, a patient may present with what sounds like prolapsing hemorrhoids, and when they come, they have got anal skin tags, which aren't hemorrhoids at all, but that can be an interpretation. Now, some patients will have internal hemorrhoids that can be treated, but the skin tags won't go away. They would need to be removed surgically on a different occasion, potentially by a different surgeon who has the skills to do that. Some of the pain that they may present with may be due to a fissure, which is a split in the skin on the outside of the bottom, which is much more sensitive. And it may be due to a thrombosed external hemorrhoid or a perianal hematoma, which is exquisitely painful, and it may not be possible to undertake a full digital, let alone a proctoscopic examination to be able to assess the inside to know whether a treatment is actually appropriate for you on that day. However, what you will get is a consultation where some of these questions can be answered based on that assessment. And then we can recommend some treatments that might be topical, that might be a different way of assessing you to actually address those symptoms, and also give an additional time when a lot of symptoms can improve anyway. And then when the discomfort is settled, we may then be able to examine you properly to assess the inside and then to determine if X-roid is an appropriate treatment for any internal hemorrhoids present, and then to carry out that treatment from that point. You might wonder, given all this positivity about X-roid, why it's not on the NHS yet. Well, there are a number of reasons. One, it's very difficult to get a new device onto the NHS, whatever it is, and that includes X-roid. We have to collect evidence, we have to present it to the National Institute for Health and Care Excellence, or NICE. They need to assess it. There are a number of different levels of NICE approval before a device can get onto the NHS. Direct current electrotherapy is the subject of NICE information guidance that was published in 2015. X-roid itself was the subject of a MedTech innovation briefing published by NICE in December 2019. So yes, it's safe, it's effective, but that still doesn't mean it's going to get on the NHS. We need a full level of approval, if you like, through the Medical Technology Evaluation Programme, or MTEP. And that is, again, something where a lot of information needs to be gathered, both historical studies as well as real-world data from us using the treatment and then presenting it to them such that they are convinced that it is something that should be on the NHS. At that point, it will then become much easier for the treatment to be made available under a choose and book scheme or other schemes pertinent to your area, so that treatment can be undertaken. On average, we understand it takes 18 years for a new device to get onto the NHS. At the moment, we're at 3 years, but we remain very positive because of the attributes of X-roid being safer. You can walk in and have it done. You don't need a whole theatre available to do it. You can carry out the treatment at home in a GP surgery with appropriate training. There are lots of positives about it that we believe make it very attractive for a new model of care to be carried out in the NHS. But it's not us to make those decisions. It's the powers that be that need to assess all the evidence and come up with a considered opinion and a recommendation. I hope you have found this information useful, but at the same time, words are words. It's often easier to understand conceptually what's going on by watching it in real life. However, given the nature of what we're doing, we're not prepared to do that, but we have crafted what we think is a very useful animation. So if you want to go and have a look at the website, it's only about 2 minutes long, and you'll get a good understanding of the whole process of the X-roid treatment from that animation.